Well, I was dragged up in the streets of Brooklyn, and I had a really rough start. Really, I was in a place where the messages I got about myself were never positive. Didn't even go to a real kind of high school at the time. I was seen as just a difficult child, and got the message that I was difficult, and lived up to it very well. I was accommodating in that way. But for me, the mentors in my life, the people that I've come across who've been kind and were able to see, I'm not going to say potential because that's too self-promoting, but more able to see your strengths rather than your weaknesses, able to look at you through a lens that says you're okay, not that you're not okay. And I had that happen to me early on, and ended up in a small community college that needed people. So they took me, and I found out that I had a brain and that I actually was pretty smart, and went from there to straight up the line, a few bumps along the road, and ended up with a dual degrees in sociology and a doctorate in counseling and counseling education. I was doing a internship in a psychiatric hospital, and they were opening one of the first drug treatment programs. This was, and they needed staff. So and I was forced to interview. When you're doing an internship, you do what you're told. And I was at that time a pretty good soldier. And they asked me if I knew anything about drugs and alcohol. And I said, I can roll a joint with one hand while driving. And I did acid with Timothy Leary, both which were true. And they said, "You're the best we have." And in fact, that was the best they had. The only caveat, though, when they hired me, was that they made me go through treatment. And that was early 70s. And when I finished the therapeutic community, mostly run by people who had left Synanon, I finished dealing with the drug use, and as a reward, they gave me my wings, which meant taking me out and getting me drunk. And that was standard procedure in those days. Drugs and alcohol were very much separate. They were two different tracks. There was not the disease model did not put both under one umbrella. I was on the track that I did give up drugs. I was addicted to stimulants, and I gave them up many times, to be honest. Till I finally gave them up for good, but never really had a problem with alcohol. But alcohol was a kind of a gateway more than a problem. The problem was stimulants, which I had many problems with. And it wasn't until many years later that I ended up in an NA meeting. And if you go to an NA meeting, at the beginning of the meeting, they talk about alcohol also being a drug. And I'm sitting there, and I said, "What? What do you mean alcohol is a drug?" Because I had gotten this message through the therapeutic community movement, which I was part of, that alcohol was okay. Matter of fact, getting drunk was okay. So I walked out. That wasn't gonna, I want the other program where you could drink. And several years later, and as we say, collecting many white chips, I ended up putting it all together and realizing that for me, it wasn't about drugs or alcohol. It was about working a program where I can grow and be a better person, where I can be kinder, where I can be, and where I could love the recovering addict, and became and dedicated my life to the field at that point, and ended up doing a lot of what you might call street work. I worked in Camden, New Jersey for about 10 years, and I did a lot of very high-end work. Professor at several universities. I was the chief psychologist, or the chief person for the Bell system. When the old AT&T, I was responsible for 1 million employees and about 100 therapists. So, and all of that was not because I was smart. It was because of mentorship. It was because of meeting the right people at the right time and people believing in me. And to be really honest, I think some people believe in me more than I often believe in myself, and I'm humbled by their expectations, but also become somewhat very anxious about those expectations because I'm not always sure that I can meet those kinds of lofty goals. But I think growth and evolving and being open is what it's about, and the program has been a very important part of my life. I migrated from the therapeutic community system to a more traditional, what was called the Minnesota model in those days. What we were doing was the best we can with what we had. We were combining NAAA with some of the therapies du jour, what was popular in the day, and we really never knew more than intuitively whether we were doing a good job or not. We knew that people got well or recovered or got into recovery through AA. We knew that. But we weren't sure about anything else really, but we did what we thought was best. I mean, it was not a popular science, and it was not a popular field for research. And that went on for many years, and there were a lot of politics, and until the third-party payers decided to put any money into drugs and alcohol, nobody really wanted to treat alcoholics and drug addicts. They were kind of the lepers of the behavioral health community. There wasn't, they were hard to treat. Nobody really believed that the treatment made any difference. So efficacy was a real issue. Relapse rates were fairly high. So, it wasn't a really good investment to treat drug addicts and alcoholics. And the understanding of what was called the disease at the time, or became the disease, was not shared. There was not a shared language. There was not a shared belief. There wasn't even a shared belief in what recovery was. I'm not sure there is today. But this whole issue about disease really became a double-edged sword, because as care evolved, the disease model pushed drugs and alcohol treatment into a realm or a ballpark of that was medicalized, that they never could survive in my opinion, when they really belonged in a behavioral health. It was really not so much about treating a disease, in the sense of the way you treat diabetes or cancer. It was more about the way people grow and become better people and deal with more positive ways of living. How do I stop using drugs and become a better person? The stopping using was only the beginning. So what we were doing mostly what would be what I would call acute care stabilization, primary care, and the idea that you can really get somebody well in 28 days was at best naive, at least retrospectively. And we had a lot of, if you will, clinical hypocrisy, in the sense that we talked about the chronic disease, but we treated people for 28 days and put them back out in the community. And I don't want to sound that I'm negative, like I'm indicting a field. These were wonderful people with heart and passion, doing the best they can do. This was not. These were the unsung heroes. The Marty Manns, the Max Wisemans, the Janet Wyatts, all people. I've been at Rutgers since 1979. I had the Vernon Johnsons, all of these people, Dan Andersons. I had a chance to be with these people, and these were people who laid a path for us.
So, it's easy to be a retrospective, smart person, but at the same time, it's better to understand the gifts we were given, not the paths we took where we could have taken alternative paths. So it's really so understanding those gifts and building on those gifts, and began to evolve to more of a chronic disease model, and we began to do more things. We began to talk about continuing care, aftercare. We began to look at things like we called them MICA clients, mentally ill, chemical abusers. Then we said co-occurring we said comorbidity. We said dual diagnosis. We used now we're saying co-occurring disorders, all which I think don't help the field a whole lot, because I think it's whole person therapy that's the most important, and I think we're moving in that direction, and not trying to sort out this pathology from that pathology, but build on strengths and deal with the whole people. So science starts to creep in here. Places like Brown, Columbia, Rutgers, Pittsburgh, other places started to look at, do some serious research. That's such a wonderful question. I would say, let me tell you what bubbles right to the surface. They were kind and loved the struggling addict and alcoholic. They really loved the people they worked with. They loved the field. They had passion. I think that was, that was the bottom line. That was what hooked me, if you will. So yeah, different people had different skills. Some people were more family. Some people were more, behavioral. Some, whatever. I think it's all good. But if you don't have that passion, if you don't have that love for people, and particularly for those who are struggling to find their way, I think you need to find something else to do it. I mean that kindly. So all of these people, I remember Jan Wyatt's just, meeting an addict and hugging the struggling addict who could hardly stand up. The Marty Mans, who were just, so kind, and all of these people were approachable. They were not, they were leaders in the field, but that's not their role. Their role was facilitators. Their role was to bring value, and they became the role models for me. And so I strive to be more of a person that is, who can add value when I can be a team member, can be, part of a system. So yeah, that's a great question. And yeah, these were just people who are still in my heart. The exciting thing for me at this point is that so much of the research is now supporting what we were doing intuitively. So we went this. We kind of went through the circle. We were doing intuitive work based on some great foundations from the Big Book, and Dr. Bob. By the way, if there's any younger people, I'm the other Dr. Bob. I'm not the original. I look like I might be, but I'm not. So we had that wonderful foundation of the early pioneers in AA and NA, and we did what we knew intuitively worked. Anecdotally, we looked at it, and then we continued to do that, and some people stayed true to that because they knew that nobody was going to NA or AA meetings and standing up and saying, "Hi, I'm Bob. I have long-term recovery because of my CBT." Nobody. We knew that CBT and MI and things like that were useful, but only to facilitate a process of recovery, not to be recovery. And we knew those were the roadblocks that had to be taken down to get us to a place where we could actually do serious step work. And for me, I have a bias, and I always like to acknowledge my bias. My bias is that is the 12 and 12, 12 steps and 12 traditions of AA and NA. And So I really feel that's been the big gift to the field, and I think when science comes together with that we tend to get the best outcomes. We really, even today, really don't know in most treatment programs whether or not we do a good job or not. We think we do. We have good people. We collect tons of data, which we never use. We do tons of research, which never makes its way to treatment. So we're in this place where you have all of these treatment programs and literally billions of dollars going into a system, and nobody really knows whether or not what we do, we know that people get well. We know that people get a recovery. We don't know why. We don't know how. We're learning more about that. Other than AA and NA, we don't know the value of doing some of the other things we do. I think we're learning. I think we're coming together here. I think the exciting thing about being in the field right now is that we're beginning to ask these questions, and for me, the questions are much more important than the answers. It's the ability to ask the questions, to grow, to evolve, and I think we're beginning to do that. And we're beginning to break down some of those silos, and we're beginning to collect data not just for promotion, but for informing care. And I'm excited about that. It's been 40 some odd years, and I've never been more excited. People ask me, how long are you going to stay in the field? I said, well, as long as the field will tolerate me. I love what I do, and I love the people that I get to meet. And the gifts are people. The gifts are the wonderful people that I get to meet, and the folks I get to work with. And now I'm doing some international work with C4. We've opened up a treatment center in Turkey, which is very exciting. In the past, we've opened up centers in places like Palestine, all over in Europe. I'm working with a treatment program called Origins Behavioral Health, which I really enjoy, and I love the people there. And I'm getting a chance to do some research with Rutgers and other places. So I'm happy to add value, wherever I can. I see myself more as a contributor to the field. I want to be one down informed. I want to be someone who can. Who is open to change and open to growing and open into listening to others, and not just growing because I think I know what needs to be done, but learning from others. And it's those exchanges, and it's that belief that fuels my tank. I would tell them that recovery is not about stopping to use drugs. Recovery is about human potential. Recovery is about being a better person. And that it's not just people that have to be in recovery, organizations need to be as well. If we ask people to take the first step and become authentic, organizations need to be authentic. Organizations need to be spiritual, not just individuals. They need to be kind, they need to be open, they need to be able to do all the things we ask of our clients, patients, whatever you call them. I would say to those people that you ought to think about whether or not you can be in a place where you can commit your life to being genuine and authentic. And if not, if it's just a job, because I don't think you can work and be successful and this can be just a job. I think it has to be, there's a commitment that goes far beyond the 9 to 5. And that's fine. It doesn't have to be for everybody. But I think that you ought to make that decision early on, based not on your knowledge, but based on your passion. And that would be the advice that I would give. there have been major breakthroughs, but not in the, not like epiphanies, not in the dramatic ways. I think the breakthroughs have been more in the sense of getting back to basics, if you will. Getting back to being human, getting back to dealing with people as they present, and valuing human beings. So the breakthrough for me is not so much becoming super scientists, although I am a recovering scientist. It's finding paradigms where people can grow, but where we can meet people where they are, and that we're not banging square pegs into round holes, and we're not trying to manipulate and change people, but we're facilitating a process of growth, not through who we are as scientists, but more who we are as human beings. So if I can bring to you another struggling human being myself, just another struggling pilgrim, then I can struggle with you and not for you. And when we learn that I don't struggle for you, but with you, and I can support you, but I value you as a human being, and the sense of humanness, the sense of being a human being, I think is the breakthrough for me. And it takes the burden. You don't have to, I don't have to be responsible for you. I just need to love you unconditionally. I mean, I think there are many spokes on the wheel. Research, ASAM, spirituality, better assessment, outcomes. All of these, AANA, all of these are spokes on the wheel. I think that I think we need it all. But so I wouldn't pick any one of the spokes to be the driver. I think it's the synergy, and I think it's something. Let me relate a quick story to you that I think is really worthwhile. I was working in my treatment program, the treatment program that I work in, and another program called up and said, we want to do some outcomes work. We're a small program. We really don't have the resources. We're not sure how to do this. It's not what we do best. And I went to the people I work with and I said, what do you think about that? And they said, we think that you ought to do everything you can to help these people. And because this is a community, we grow together or we sink together. And I think when we begin to learn that we're, that it's not competition, and that, it's a matter of attraction, not promotion. And we spend much too much time in promotion and not enough time in attraction, which we're taught by the Big Book. And so for me, I think it's a sense of building community far beyond the walls of our individual treatment programs. All of the other things like that you talked about, like what's now called, I guess, medically assisted or medication assisted therapy. For me, all of these things have a role. I don't believe in throwing anything out, because the thing I throw out might be what the next patient needs. So I think it's a bit pompous to say my way or the highway. What I say is that this is what I do best, but if that doesn't work for you, maybe you belong over here, and that's fine. Because as long as the goal is the same, and the goal is human growth. The goal is quality of life. That's the goal. To facilitate a process where human beings have the right end to live a life of quality. I think that's... I don't want to define that for people. I have a hard enough time defining it for myself. I don't want to define it for others. But I want to help to build pathways to living better lives. Yeah. I believe that there are different ways to get from point A to B. That you need to find your way. That I can point you in a direction, but I can't tell you what to see. I need to give you choices, and you need to make them. And I think that
that's part of the process of recovery. For me, it's working steps. I find that by working the steps, all of the other psychological and social processes that we talk about, whether it's MI, CBT, whatever, whether it's spirituality, whether it's, I find that it all happens through the steps. But even the steps, I travel a lot. Even in the United States, the steps are seen differently from the East and the West. That's fine. It's a process. You need to find, at some point as you go through life, you become a bit more discriminating. You take what works, and you continue to do that, and what doesn't, you leave behind. And I think that's kind of a process of the process of growth in life. I'm happy to be in an industry where I can do that, where I can find not just a job, where I can find an arena for personal growth, and be around people who love me, who are kind. I mean, where else can you find that? Certainly not on the stock market. So I'm humbled by the fact that I'm able to do what I do. I'm humbled by the fact that people value some of my contributions, and I find that to be the greatest reward. Number one on my list is to break down silos, more communication, more sharing, more of a community. That we begin to have a more common language. We begin to be open about what we do. I'm a scientist. I find better ways to use science to support what we do. Not just use science for promotion, but for growth, to inform care. So I think that we need more bench to trench, but we need more trench to bench. We need to not only have the universities and the researchers inform the care, I think the care needs to inform them. So I'd like to see more communication on that level. I would like to see I would like to see a breakdown in have more of a continuum of care rather than levels of care. I think ASAM has brought us a long way. I think we need to go to the next step. I think the next step is to break down levels of care and stop talking about levels and start talking about a continuum of care, and honestly meeting the patient where they present. So for me, I would like to see. I think we'll do fine if we can come together as a community, and that we can value each other. And I think the value of the PhD scientist is no greater than the young recovering person. And I think we need to value everybody's input and not have a hierarchy of who's important, because I think that it's all part of the mix. And I think so I want us to be more open and more inclusive, not exclusive. I have a intuitive belief that we're moving in the right direction. I know there are a lot of people out there who are kind of naysayers and doom masters. They see the light at the end of the tunnel as being the oncoming train. I do not. I'm optimistic. I think we're making great strides. And I really believe that if we stay the course and we open our doors and we're kind and we do the right thing, that the returns will be there. And so for me, there are not major changes I would make in that way. I'm not a politician. I'm not, but I do believe that if we continue to do the kind of things you're doing here right now, sharing information, being inclusive and open,
I think that we will succeed, and I think we need to measure success, as growth, and not in terms of reaching certain hurdles, but in terms of having a process of growth and developing better quality of life.